Hello, good evening. Dr. Chidi Fondu of Snowspirations Global Health Solutions. Thank you and welcome to our open clinic this evening. And this evening, we're going to talk about age 35, the significance of age 35 in a woman. And we're going to look at the pros and the cons, the risk factors, the advantages a lady at 35 might have, and the risk factors that should be expected. 35 years is a very significant milestone in the life of a woman, especially if she's desiring to be a mother. So what I intend to do in the next 30 minutes is to share with us expectations, advantages, risk factors. So once you come in, just join me after my presentation. You will have opportunity to ask your questions. I intend to keep it pretty much factual, straight to point. Now, here's the deal. As a woman, the moment you come into this world, you already have the complete set of everything you need to be a mother. So you're actually a mother before you came into this world. Now, for women, you have eggs resident in a sleeping phase in the ovaries. So you have two ovaries. Inside the ovaries, you have complete set of the eggs you will use to start your family. Now, as you're getting older, things will be changing. You'll be losing a couple. Now, the significance of age 35 is the fact that those eggs you have from birth at age 35, we normally notice a drastic drop in both the quantity and quality. Now, there are significant changes in the body of a woman at age 35, and there are also some risk factors expected when she eventually becomes pregnant. So here are the facts. Pregnancy from age 35 up will be challenging for some women, not all women. Some women will even have smooth pregnancy, even some up to mid-40s, some 50s, okay? So long as you have eggs, you can become pregnant. But factually and medically, what we noticed is that at 35, your fertility starts dropping simply by the factor of age. So 35 is a significant tipping point in a woman's fertility and ability to become pregnant. Now, there are some notifiable changes and risk factors which you should be conversant with. Now, understand, I know you might have heard so many stories and some people will be freaking out. Oh, am I still going to get pregnant? Am I still going to be a mother? Yes. The fact remains there are some challenges. We need to have a knowledge ahead of time so we can figure out how to mitigate the challenges. Now, the concept of biological clock is a fact in life. Biological clock is actually more applicable to women. For some reason, men have an extended biological clock. But for women, you have 3 seasons. You have your morning, you have your afternoon, you have your evening. So when you get to that 35, you are gearing up to go to the evening side. It's your biological clock. Getting old is not a disease. Everybody is going to get old. So when you get to age 35 and you're intending to be a mother, you are classified as advanced in maternal age, simply for the mere reason that we want to keep a golden eye on you and make sure you're in the right direction. We are not using the advanced in maternal age to make you feel like you are not going to be a mother. You're going to be a mother. There are so many women that actually became mothers, from age 35 up. Matter of fact, with the advent of modern technology, so many women are becoming pregnant later in life compared to earlier in life. So there is nothing to worry about. So long as you are well equipped, so long as you have your knowledge base, so long as you have a good fertility specialist, you can still become pregnant. Now, let's talk about the pros and cons. Let's start with the pros. Let's start with the advantages. You see, the fact your eggs are reducing at 35, for some reasons, you have an increased probability of having multiple pregnancy. Now, multiple pregnancy can be a plus for some women. And in some women, it can actually be a source of a lot of complications, because the way the body of a woman is structured, your body ordinarily is structured to take care of one baby. So the original design of the womb is to take care of one baby. When you have multiple pregnancy, it means you might have twins, it means you might have triplets, it means you might have quadruplets. So the higher the number of babies you're going to have, the more the complications. But this is a good advantage. So women from age 35 above will have a higher probability, a higher chance of having twins naturally, or if they go for assisted reproductive technique, a higher chance of having triplets, a higher chance of having quadruplets, simply by virtue of your age. What happens? Your egg tends to divide more when you are getting old. So the possibility that one egg will be fertilized, then they will divide, and you will yield what? Identical twins. Or you will release more than 2 eggs, and those 2 eggs will be fertilized by 2 different sperm, and you will have non-identical or fraternal twins. So you have a very big advantage. This is advantage that we know. Now, there are a couple of other social advantages, but we're going to stick to medical advantages and risk factors. So I've talked about the advantages, okay? Let's talk about the risk factors. Number 1, it might take a little bit longer to become pregnant when you're 35 and above. A little bit longer. Why? Because as you're reaching your mid-30s, you will have a drop in the quantity of the eggs and the quality. So if we are contending with only quantity, we can deal with it, but we are also contending with quality. So at any point in time, when you get to the ovaries of every woman, you will have a ratio of normal and abnormal eggs, quality and non-quality eggs. So by the time you get to mid-30, about the age 35, you will notice a switch. So you begin to see a preponderance of more abnormal eggs compared to normal eggs. So you're going to struggle. But it's a struggle, it's a challenge. This is the point you need help. So as you're getting older, the possibility that all those eggs are not going to be fertilized is going to be high. The possibility that you need help is very high. So once you get to that age 35 and you have been doing your best to become pregnant. So what's doing your best? You pray to God, you make love regularly, no time love making. Then if it fails after 6 months, you need to get help immediately from a fertility specialist. Now, number 2, risk factors. Now, I've already mentioned this. You can see it as an advantage, or you can see it as a disadvantage. Majority of women will see it as an advantage. So you have multiple pregnancy likelihood. You are likely going to have twins, triplets, quadruplets when you go for your assisted reproductive technique compared to a younger person. So this is a very big advantage. And in some women, it might be a disadvantage because it's not every woman that can nurture multiple pregnancy. There are some women that their womb can only contain one baby. So if you happen to expose yourself to multiple pregnancy, you might have some risk factors. Number 3, unfortunately, in some women, especially when they cross this 35 mark, they might likely develop what we call gestational diabetes. This is a special type of diabetes that some women will develop when they are pregnant. So when we have a comparative analysis of younger women below 35 and women above 35, women above 35 will have a higher possibility of having gestational diabetes. Gestational diabetes is a special type of diabetes that some women in pregnancy will develop during pregnancy. Then thankfully, after pregnancy, your body sugar level will come back to normal. So it's important we have a tight control of your blood sugar through dieting, through physical activity. And in some women, we might give medications because if we don't treat the diabetes, it can affect the baby. Some baby might end up growing so big to become what we call macrosomic babies, which can be a problem in course of delivery. So one of the complications of having gestational diabetes is the fact that you're going to have a big baby. Now, your body might not be ready for big babies. So during delivery, we might tend to have a couple of complications. And these babies can be at risk of being born early, having blood pressure, or developing other complications, especially if the babies are big, okay? Your babies need to be relatively a good size so your baby can pass through the birth canal during labor. Now, also, unfortunately, women age 35 and above will likely develop pregnancy-induced hypertension, which we also call preeclampsia. The good thing about all these conditions, once pregnancy ends, a majority of the women, their blood sugar will come back to normal, their blood pressure will come back to normal. But your possibility of developing gestational hypertension or pregnancy-induced hypertension, it's higher when you get to age 35. So for some reason, from researchers, we discovered that when your pregnancy is a little bit above, when you're from 35 years and above and you're pregnant, you tend to develop more hypertension during pregnancy. So it's important we control your blood pressure during pregnancy. If you are already a known hypertensive, it's important that the numbers on top and below are properly controlled, because hypertension can complicate your pregnancy. Preeclampsia is a complex of increase in your blood pressure, generalized body swelling. Then when we look at your urine, we see some signs of protein. When you have these three combo, it's a possibility you have preeclampsia. You must be attended to immediately. Preeclampsia is a deadly complication that can happen in pregnancy. Now, for some reasons, babies that are going to be born from 35 years and above will likely be born smaller for gestational age. So the possibility that you're giving birth to a low birth weight baby is high if you're at this age, for simple reason of couple of challenges. So you tend to have more babies that will come small when they are older than 35. When the mothers are older than 35, some babies, not all, will present with low birth weight. Now, the possibility that most women who are gonna become pregnant from age 35 up will have their baby through CS is very high. Cesarean section delivery is an emergency intervention. Prior to the discovery of cesarean section, so many women couldn't make it, so many babies couldn't make it. So it's a salvage mission. So most women from age 35 up will likely have their babies through cesarean section. Why? Because you tend to have a couple of complications we want to avoid, one of which is placenta previa. Now, in some women, they might have low-lying placenta that can cover the cervix, which is the junction between the womb and the vagina. So when you have placenta previa or low-lying placenta, there might be an indication to deliver the baby carefully or early. So we don't want to take chances. So most times, if a pregnancy is troubled, if we don't want to take chances, we quickly go in for elective cesarean section. So most women in this age bracket will go for what? Elective cesarean section. We are not going to allow you to go into labor because a couple of things can go wrong in labor. Now, I'm not saying that all women above age 35 are going to have CS. So many women can still have their babies through the vagina, but I'm just looking at the general population in relationship to the age 35. Now, unfortunately, from age 35, you also have an increased risk factor of having babies that will have chromosomal problems. So the older you are, the more your baby might develop Down syndrome, Edwards syndrome, and all those syndromes out there by default. Unfortunately, there is nothing you can do about it. Okay, now some people can go for genetic counseling, some people can go for PGD and all that, but naturally, if your baby is going to develop genetic problems, if your baby is going to develop chromosomal problems, nobody can stop that. But there are a couple of things we can do ahead on time. We can look at the egg, we can look at the sperm, we can look for the best, but this is just a limited effort because at the end of the day, God is the ultimate decider, but the possibility that you might likely have a baby that might have chromosomal abnormality is higher from age 35 up. Okay? Now, unfortunately, I'm going to use this to close. Unfortunately, when you are age 35 and above, the possibility you will have increased risk of losing your pregnancy is higher. So women above 35 will likely have miscarriage compared to women that are younger. Women above 35 are likely going to have more stillbirth compared to babies that are younger for some reasons. So The fact remains that if you want to become pregnant at 35, when you succeed, we need to keep a golden eye on you. So you can see the reason why we classify you as advanced in maternal age, because we are worried. We don't want anybody to lose their baby. So if your baby will have an increased probability of dying from miscarriage or stillbirth, what do? We give you close monitoring, close attention. So these are the individual risk factors that women above age 35 might likely be exposed to. So increased risk of miscarriage, stillbirth, chromosomal abnormality, possibility you're going to have your baby through CS, possibility your baby will be born early, so low birth weight, babies that are going to be born premature, possibility you might develop pregnancy-induced hypertension, possibility you develop gestational diabetes, possibility that you will find it more difficult to become pregnant when you get to this point. These are medical facts. Now, there are always exceptions to everything we do in life. In medical field, there is no never, there is no always. There are still some women who by themselves can become pregnant at mid-40. There are still some women who by themselves can become pregnant naturally at 50. But when we look at the general population, once you get to this age 35 and you begin to have challenges, please get help. The earlier you get help, the better. Okay? All right. So the clinic is going to open now, and you will have opportunity to ask your questions in real time. So please feel free to ask your questions in real time. COO, thank you so much for coming. Spears and Tosi, thank you guys for coming. It's time for your questions. Please go ahead and let's talk. Hopefully, my light is shining better. We're getting better, okay? Guys, let's talk. Ask your questions. Okay? Tosi, I hope you enjoyed the masterclass. I think COO, we're going to find a worthy award for this lady. She's really been consistent. When is a woman most fertile? This is a very important and technical question. So, are you asking in relationship to the ages? If you're asking in relationship to the age brackets, the best time, the most fertile period for a woman to become a mother is in the 20s. That's the best time. That's the recommended time. We don't recommend women to become pregnant before 20. That's called teenage pregnancy. We don't recommend that. We don't recommend teenage mothers. Unfortunately, in some places, some babies will be born before 20, but at that stage, the pelvis is not fully developed. The mother is still a baby. It's not good to have babies having babies. So the best time, if you are blessed, if you see your partner, if you are more settled, if you are old enough to handle relationship, the best time to have all your babies, it's when you are at the peak of your reproductive life, which is in your 20s. So if you begin to go up, your fertility index will be dropping. So you are more fertile in your 21 compared to your 35. You are more fertile when you're 25 compared to when you're 30. You are more fertile when you're 30 compared to when you're 35. So the older you are, the more the decline in your fertility will happen. It's a decline. It doesn't mean you can't get there. You can still get there. There are some women that have very high fertility index. We call them women with high fecundity. There are some women that can practically become pregnant anytime sperm enters their body. These are very rare women, okay? But it can happen. All right, keep asking your question. If a woman does not have a male partner yet, how can she preserve her fertility? You see, I've told you guys severally, this lady deserves an honorary award as a classical clinician. So here's the deal. In developed countries, if a woman has the facilities and she knows fully well she's not going to be ready in next 20 years, in next 10 years, and she's in her 20s, she can comfortably meet her gynecologist, meet her OBGYN, go to a fertility specialist, and we can freeze our eggs. So women can freeze their eggs. And it's advised, if you want to go this route, please freeze your eggs when you're in your 20s. Don't freeze your eggs when you're up to 35, because the aim of freezing your eggs is to make sure we get the best eggs, we freeze them so that when we need them in the future, we can use them. So if a woman wants to preserve her fertility, because your eggs are expendable, your eggs are going to finish. It's not like the sperm. The sperm is produced every 3 months. So the best way to preserve your fertility as a woman is to look for the facility. So if you're in America, there are so many facilities that can freeze your eggs. So you can be getting ready to go to college. You don't have a job. You don't have a partner. You don't have money. You're not settled. You're not matured enough. You can go to a clinic. They can freeze your eggs. Now, when you get to your 30s, even 40s, we can use that frozen eggs in your 20s and you can start your family. Guess what happens? If we freeze your eggs at 25, then you end up seeing your partner at 45. What's the age of that egg when you start wanting to have a baby? 25. So a woman that froze her eggs at 25, then found her partner at 45, the egg we are going to use to get her pregnant will be 25. And a 25-year-old egg, it's more quality compared to a 45-year-old egg if you still have eggs. Very important you understand this, okay? All right. Should she consider routine fertility evaluations? By default, once you nurture that ability, once you nurture that aim of being a mother, we normally recommend you go for well-woman check. But once you and your partner are together, we also recommend you go for what? Pre-conception visit. So every woman by default is encouraged to keep an eye on your hormone profile, keep an eye on your body weight, keep an eye on your mood, keep an eye on everything that makes you a woman, because everything that affects you can affect your fertility. So yes, whether you're single, whether you're married, please go for routine well-woman check. Well-woman check means you might not have fever, you might not have discharge, you might not have pain, but you bring out one day in the 365 days every year, then you see your OBGYN, we take a look, we look from head to toe, and we make sure you're in a good place. It's generally advised for all women. Okay? And if she has a male partner that isn't ready to get pregnant, are there fertility-friendly contraceptives? Now, you want me to tell you the truth? Every of the 13 different contraceptives you will use, they have their pros, they have their cons. Now, of all of them, anytime you are introducing any contraceptive in your body, sometimes they might do the wrong things. So you can have side effects or adverse effects. Now, of all of them, the best form of contraceptive might not be the ones you guys might desire. You see, condom? Condom is about the best because condom can protect you from STI, and also if it's used properly, can protect from pregnancy if you're not ready. Now, why? Because it's a barrier method and it doesn't really contain much chemicals, because the problem is in contraceptives, what are we doing? We are using the hormones you ordinarily have in your body. We use it in different quantity to prevent pregnancy from happening. So if you're using pills, if you're using injectables, if you're using implant, if you're using IUD, anything that enters your body can alter your body. The problem with using some contraceptive is washout time. So when you stop using contraceptives, in some women, they can have a momentary period of infertility before their fertility will bounce back, okay? So there are 13 different methods of contraceptives for women and about 2 for men. The best in regards to preserving your fertility by default should be condom, but most people will not find it convenient, okay? All right, good evening. Let's see what we have from Tosi. Good evening. You're going to be 36 in August. You had your babies back to back, 2020, 2021. Okay? Is it advisable for you to wait 3 more years to try again? Okay, my sister, remember the recommendation, 18 months. Okay? So let's do some math. You had the first baby in 2020, right? Then you had the second baby in 2021. So you didn't really observe that 18 months. You did not. Now you're 36. If you ask me, if everything is okay with you, if your ovarian reserve is good and you're 36, and you already have 2 babies, and you already have one within just the space of 1 year, get some time. Spend that 18 months. Okay, so if you had a baby in 2021, December, this is June, at least don't think about having any other baby until mid 2023. So everything about having a baby or not, you can delay it to 2023, because by that 2023, this baby you have now, mid 2023, you would have spent 18 months. Your body would have been fully recovered, and you will still be just 37. So long as you don't have any fertility issues, remember you have 2 babies now, which is a blessing, and you want to top up to your family, then wait till mid 2023 to go again. I will personally not recommend you become pregnant in 2022. This is not the year of pregnancy. This is the year of raising the 2 babies you have. You had one in 2020. You have another one in 2021. You cannot have another one in 2023. Please. You should be targeting 2024. Okay? All right. You're a candidate for sarclage, progesterone, Rogan, and okay, is it the same? So you have rhesus incompatibility. Okay, so if you're a candidate for sarclage, then all subsequent pregnancies, you're going to be given preventive sarclage. So sarclage is a preventative measure we use in securing the integrity of the cervix. Some women can have cervical incompetence. Some women can have very weak cervix that if care is not taken, when pregnancy happens, they can deliver the baby early. So if you have some risk factors of having cervical issues, we give you cervical sarclage. Then for your progesterone is a hormone we use in supporting some pregnancies, because progesterone is pregnancy maintaining hormone. Okay? Then Rogan, we give Rogan for women that have incompatibilities. So incompatibility means you and your partner are not the same blood group. So you are negative and your partner is positive. When we have such situations, first pregnancies will be spared, but subsequent pregnancies, if the baby you have on inside of you is positive, your body will begin to see that positive baby like an enemy, and your body will begin to build soldiers we call antibodies to attack your babies from second pregnancy on. So we normally give you a protective injection we call Rogan. So all women who are rhesus negative, so that means you are A negative, you are B negative, you are O negative, AB negative, we must give you Rogan for all pregnancies you are going to have. Very important. Very, very important. You cannot afford to miss this. Okay? All right. How long should you wait for your womb to get healed before becoming pregnant after hysteroscope? Hysteroscope is just a procedure. It's a diagnostic procedure. I'm sure the provider that conducted the hysteroscope gave you a time frame. So this is what I will tell you, because I don't know your history. I don't know the state of your health. So please ring your doctor that conducted the hysteroscope. Ask your doctor, is he okay now? And remember, if you're going for hysteroscope, we need to interpret the results. And based on the result, we can now tell you what to do. So the best person to tell you when to start or continue or to stop should be your doctor. Anytime you have any diagnostic procedure, when the result comes out, the doctor that requested it should review and tell you what to do. Okay? All right. Do we have any other question? Chizoba, I believe you're from Israel, right? Chizoba, Joy TV, Shalom, please ask your questions. Everybody is free to ask all their questions. Remember, today we're talking about age 35. Why is age 35 important? Why is this significant in the life of every woman that wants to be a mother? Because as you get to age 35, you are classified as advanced in maternal age. There are some risk factors you need to be conversant with. Number one, you are going to struggle. Some women are going to have challenges becoming pregnant faster. Most women are going to have problems with gestational diabetes, pregnancy-induced hypertension, probability of having your baby early, probability of going for CS, likelihood of having a baby that will have chromosomal problems. So these are issues you can likely have when you are having your baby from 35 years and above. This is why once you are pregnant, matter of fact, when you are hovering around 35, before you even become pregnant, go for pre-conception visit. We have to plan everything. A planned pregnancy will yield a very good outcome. 9 months is a long time. So if you are currently pregnant and you're 35 and you think you're an ordinary mother, be careful. Make sure you have a standby, standard, experienced well-oriented doctor that will guide you, because 9 months is a long time. We don't joke with our pregnancy, our pregnant babies, our pregnant mothers, especially if you're 35, because it's difficult. It's difficult once you're older. It's difficult to become pregnant. So once you become pregnant, we must keep an eagle eye on you. Very, very important. Very important. We have 1 more minute to go. If you don't have any other question, then we're going to round up. June was very amazing. We thank all the people that attended the event on Sunday. If you missed that event, you missed a lot. 3 hours of intensive bombardment of infertility. We were able to dissect all male factor infertility, all female factor infertility, and we were able to proffer solutions. So please, as we are entering July, please review your journey. We've spent 6 months in 2022. Are you there yet? Are you pregnant yet? Have you lost that body weight? Do you think you're going to get pregnant? Do you think you're going to be a mother? Do you think you're going to be a father? Ask yourself the questions genuinely. Stop living in denial. Stop avoiding responsibility. Don't tell me you're waiting for it. Don't tell me you're waiting for God. God cannot come down. You need to take your bold steps. So as you're entering July, ask yourself those important questions. If you're in the right direction, then keep going. If you're not, get help. Our organization can help you. If today is the first day of attending my clinic in YouTube is every Tuesdays and Saturdays. Tuesdays, 6:30 p.m. Eastern Time. Saturdays, 12 p.m. Eastern Time, 5 p.m. Nigerian time. So every Saturday, every Tuesday, you will see me talking about a topic I love talking about. Everybody in this group will eventually become a mother. Everybody in this group will eventually become a father. But the question is, how soon can you be a mother? How soon can you be a father? Do you want to become a father faster or later? Do you want to become a mother faster or later? The earlier you start your family, the better. If there is any time to start having kids, it's now. It's not tomorrow. It's not next year. It's today. But once you start, get there. Until you have your baby, don't ever give up. Okay? Thank you so much. And 2 a.m. in Israel, okay? No problem. Thank you for coming. And I'll see you guys again on Saturday. But please remember, if every other thing fails, pray to God every single second. Play 48 hourly. Play means make love to your partner 48 hourly, then practice. Everybody that is looking for a baby should have a doctor, a very solid doctor, a doctor that knows his stuff, a doctor that will give you good advice, a doctor that will have your back, a doctor that will tell you the truth. So if you don't have one, you can get one in our group. Now, if today is the first day of attending my clinic, please, before you leave, subscribe, hit the notification button so that subsequently you can be like Tosin. Tosin has never missed any of our events. The more you're knowledgeable, the more you're going to be in charge. The more you're going to be in charge, the more you're going to crumble your challenges, because so far as you're in this world, you're going to have challenges. So knowledge is the biggest weapon you need. So go back and review all the videos we've also loaded in this group. But I thank you guys so much, and I'll see you guys again on Saturday. Until I see you, God bless you and enjoy your evening for now. Bye-bye.